transmitiendo nuestra comunidad al mundo.
Good morning, everyone, and thanks to our followers on Facebook Live session. We love Nogales, although I think the name of the company's changed. It's Meta now, I think so, but we still call it Facebook for now. Welcome to all of you. My name is Eladio Pereira. I'm Chief Medical Officer at Mariposa Health Center in Nogales. With me, my esteemed colleague, Associate Medical Director, Dr. Phil Williams. Welcome.
Thank you so much, Dr. Pereira.
Thank you for joining me. And with me is Edgardo Munoz, who's been recording and helping us all along. Thank you, Edgardo, for everything you do to help us with this. So today's Friday, October 29th, and still a lot of work to do with public health issues and vaccines. And we wanted to connect with our community to review our plans for COVID-19 boosters, essentially. But before we do COVID-19, we just want to emphasize the importance of influenza vaccine. The purpose is to reduce the respiratory burden among the community members. So I just want to make sure that people know influenza can be very, very difficult. Typically characterized by an abrupt onset of high fever, sore throat, cough, and just profound muscle ache. That's typical influenza. And we have a vaccine that can reduce the risk of disease as well as severity of illness and reduces mortality in those at risk. So at the rec, we'll do 18 and over. Dr. Williams, you want to talk about influenza vaccine in children?
Yeah, of course. So, the influenza vaccine can be given for kids starting at age 6 months. And initially for kids, it is two initial doses. And after that, it is a yearly dose. We're doing influenza vaccines at all of our locations, Nogales, Nogales West, which is near the hospital, also at Patagonia and Rio Rico. And then we will be vaccinating at the rec only those 18 and above for the influenza vaccine.
Muy bien. Y ahora en español estaba comentando que es importante vacunarse contra la influenza. Influenza es una enfermedad viral que está caracterizada por síntomas que empiezan de momento, fiebre muy alta, dolor de garganta, tos y dolor muscular muy intenso. Tenemos una vacuna que se da anualmente que reduce el riesgo de enfermedad y el riesgo de complicaciones y el riesgo de muerte como resultado de la enfermedad, particularmente en aquellas personas que tienen un riesgo alto, problemas cardiovasculares, problemas pulmonares, etcétera. So, recomendamos la vacuna de la influenza. El CDC indica que se puede administrar a la misma vez que la vacuna de COVID-19, pero si la persona no lo desea, podemos dar una vacuna primero y dar la otra después. Aquellos que ya han recibido la vacunación primaria de COVID-19, ya sea Pfizer, Moderna, Johnson & Johnson, quizás deben considerar ponerse la influenza primero. De esa manera ya crean protección para la influenza. Toma un tiempito en crear los anticuerpos para protección. So, esta es la vacuna del flu. La vacuna de COVID-19 tenemos 3 disponibles y desde la última vez que hicimos esto han aprobado los boosters. la última vez que aparecimos en esta sesión, el booster de Moderna y Johnson & Johnson no había estado aprobado. So, on the COVID-19 vaccines now, since the last time we were here, we only had booster for Pfizer. Moderna and Johnson & Johnson had not been approved. Now they are. So I'm going to have Dr. Williams review that a little bit in terms of what's available. We want to vaccinate those under certain categories, and I'll mention the first one. One is people over 65, and we want that vaccine to be given 6 months after the second dose. So what are the groups that we want to vaccinate?
Sure. In addition to age 65 and older, it's also people that live in congregate settings. It's also people with certain medical conditions. And there's a list. If you go to the CDC website, you can see that. But some of them, even something as simple as a BMI of 25 and greater, former smokers, current smokers, there's a long list.
Right.
Another group is people that are in high-risk professions. So, for instance, healthcare workers, we've actually been vaccinating all this week at Mariposa. Also, that group includes teachers and grocery workers. Again, if you go to the CDC website, they outline who that is. And then who are we missing?
Trabajadores de alimentos, maestros, grocery workers, postal workers, really anyone in contact with public often. And, that list is there for guidance. We can always use our judgment and recommend that anyone who's concerned about their immunity and getting COVID-19, that should get a booster.
Exactly. And also people who live in congregate settings. So that can mean nursing homes and then, of course, even college students, for instance, that live in dorms.
Right. And those with chronic conditions could be younger. So 18 through 64 as well. So that's a good thing. The other thing is about the booster. Johnson & Johnson is 2 months after that first dose instead of 6 months with the other one.
Exactly. And the Johnson & Johnson booster is actually for all people who received the Johnson
Correct.
& Johnson.
Right.
As long as
So that
older.
Johnson & Johnson for everyone, not just the categories for the Pfizer Moderna. And we're going to be at the rec answering questions. And so I know sometimes this is a little difficult to keep up with. But we'll be there and do our best. Okay. En español, la vacuna para los boosters de Pfizer y Moderna y Johnson & Johnson se recomiendan para pacientes de más de 65 años, pacientes más jóvenes que tienen condiciones crónicas, problemas cardiovasculares del corazón, de los riñones, y para aquellas personas que viven en ciertas residencias, en nursing homes particularmente. Y en ciertas ocupaciones, maestros, trabajadores de la salud, policías, etcétera, etcétera. Vamos a estar allí contestando las preguntas en el REC el día 2, el 4 y el 5. Si hay una pregunta allí vamos a estar. And then children. Mm-hmm. So I'm going to let Dr. Williams cover that in terms of what we think may happen and how we're going to be ready to deploy our children's vaccine.
Yeah, it's actually extremely, extremely exciting. I know a lot of parents have been waiting really a year and a half to have a vaccine for kids under the age of 12. And so, as you know, the first vaccine is going to be the Pfizer vaccine for kids. Pfizer completed all of their phase 3 clinical trials in the age group of 5 to 11. In the study, they enrolled over 2,200 kids, and the data has been outstanding. Almost 91% effectiveness in preventing symptomatic COVID. So very, very, very high numbers, similar to the high numbers that we saw in adults for Moderna and Pfizer. The Pfizer vaccine for kids is going to be 2 shots, and they're also going to be 21 days apart. And the dose is a little bit different. It's going to be 10 micrograms, which is basically a third of the dose that was given for adolescents and also for adults. And the great news is that there were no serious side effects reported, such as myocarditis or inflammation of the heart. And it's also important to say there was a few kind of important dates that have happened over the last month or so in terms of vaccine for kids. The first one was on October 7th. The FDA, they received all the safety data and the efficacy data from Pfizer. And then on October 26th, the FDA advisory panel, they recommended the vaccine overwhelmingly. And it's important to remember, this FDA panel is a conglomeration of experts all throughout the country and in all different fields. So they really are experts in the field. Overwhelmingly recommended it. And then we think on Monday, the FDA is going to give authorization. And then the CDC advisory panel is going to meet on November 2nd. And we expect to have the CDC go ahead and approval by the end of the week. And then the CDC director, Dr. Walensky, will likely endorse the vaccine for kids then.
Great summary, great summary. So by the end of the week, we expect for CDC to approve that vaccine. And here in Santa Cruz County, we're going to be ready to vaccinate children that Monday, that same Monday, November the 8th. We're going to be vaccinating for children the 8th and the 10th. Our plans are to start at noon to accommodate children's schooling. That way they can leave a little early, and we'll be there until about 6 or 6:30 or 7. We'll see how it goes. And we'll do the same on Wednesday at noon. So we'll see how it goes. We're going to have other days to vaccinate the children. We're going to have to do it all over again. But we're excited to be able to offer that. We're going to be posting our vaccination dates on our website, our Facebook page, and the Santa Cruz County. We've chosen, I believe, about 16 dates we have for November and December, and that's just the beginning. We're going to choose other dates to vaccinate, but we hope to begin children's vaccine. Y ahora en español, el doctor Williams repasó el proceso que se utiliza para aprobar las vacunas, desde la aprobación del comité del FDA hasta el CDC. Anticipamos que la vacuna de niños va a estar aprobada para la semana que viene. Aquí en el condado de Santa Cruz vamos a estar listos para aprobar las vacunas, para administrar las vacunas el siguiente lunes, que va a ser en noviembre 8. Vamos a estar ahí empezando al mediodía. Hicimos el cambio de horario para acomodar a los niños y las escuelas, para que no pierdan tiempo en las escuelas. Y vamos a hacer lo mismo otra vez en noviembre 10. Tenemos otras fechas que hemos escogido para vacunar. La vamos a poner en la página de Facebook, en la página de web y la página de web del Condado de Santa Cruz. Tenemos un nombre que compartir. Preferimos que hagan cita para las vacunas. Nos da la oportunidad de preparar las vacunas. Requiere tiempo, tenemos que decir cuántas vacunas, más de Pfizer tenemos que decongelar, etcétera, etcétera. Le pedimos que utilicen este número, es el 223-4337. Vamos a tener en el futuro próximo, se pueden registrar, hacer citas de manera digital próximamente. Estamos trabajando en esto. Tan pronto esté disponible, lo vamos a publicar. So for those who want the vaccine, please book your appointment at 223-4337. We're going to have an online registration process that will link to our system. That's coming up soon. But for the time being, we do suggest that you do register in order for us to prepare the number of vaccines we have to take to the rec and minimize waste of the vaccine. Right, Dr. Wheeler?
Exactly. Also, we will be concentrating our efforts at the rec. So during those dates, we won't be giving vaccines at the Mariposa Main, but instead we'll be vaccinating those patients at the rec.
That's a good reminder. Thank you for doing that. Le quiero acordar que traigan sus tarjetas de vacuna. De esa manera le podemos añadir ahí la vacuna de booster o la vacuna que reciban ese día. So, please bring your vaccination card to your appointment so that we can add your booster or any vaccine that you get. So I think that's all that we have for today. Eso es todo lo que tenemos. Repasando las vacunas, Moderna, Pfizer, Johnson & Johnson, booster están aprobados. Vamos a estar allí la semana que viene. Tan pronto las vacunas de los niños estén aprobadas, allí vamos a estar en noviembre 18. Doctor, anything else you want to cover?
Yeah, just a reminder to everyone to still not let your guard down. Obviously Halloween is this weekend. We have holidays coming up for the next couple of months. COVID is still here. We're still seeing almost daily cases of COVID. So please continue to do all the safety measures that we know. Continue to wear a mask. Continue to really be vigilant.
Right. Good reminder. Thank you for that, Dr. Williams. With that, I think we're going to end our session today. I want to thank everyone for joining us. Appreciate your help, and we'll see you at the next session. Muchas gracias por todo. Con esos comentarios del Dr. Williams vamos a concluir la sesión. Nos vemos en la próxima. Buen día. Bye bye.
Transmitiendo nuestra comunidad al mundo.